for keeping you waiting. I traveled this morning and I had a little bit of challenge somewhere. And I want to say thank you for waiting. And in a special way, allow me to welcome the team of Absa to Lrrh Hospital. We should have made this trip long ago. You are very much aware about how I disturbed you. Do this, do this, do this. And I was doing all that because I want to ensure that the cylinders don't get lost. We are extremely grateful for partnering with Absa. As you heard from his speech, it is not the first time. During the first wave, Absa came in very, very, very handy to support the Ministry of Health in the pandemic. And during the second wave, they also saw the area of greatest need, which was lack of oxygen. And Absa, I want to thank you for choosing only 4 hospitals in Uganda: Lrrh, Jinja, Soroti, and Gulu. We feel special because you saw our need and you responded. These cylinders are very vulnerable to theft. And already the cylinders that we have been distributing across the country are being stolen. And they are taken away by welders. So when cylinders are not embossed and they are not taken on charge, we lose them very fast. So hospital director, I do hope that you will keep these cylinders safe. JMS has committed to refill them. It does not mean when JMS is ready, you only have to give in these cylinders. Cylinders change. As long as they are 40, you give them to fill. They are now property of government of Uganda, not for sale. And please ensure that that is respected. A special thanks to your teams as well. I am happy that you could visit the hospital and see what it is like. I was talking to the managing director and asking how long Absa has been in Lango or in Lrrh, and he told me over 10 years. And so I said, but how comes I didn't know? But I was reminded that I actually know. So I will still pass by and wave to Absa and say thank you. And also look for customers to bank with Absa. It is important for all of us to know that we still have COVID in the country. Right now, we have 3 regions that are not doing very well. The region that is most affected is Teso sub-region, followed very closely by Kampala, which makes it 4 regions, and Lango and Acholi sub-region. I am sure when you visited Soroti, I don't know whether it is a few days ago, the hospital director was saying he hopes they don't use the tents. You will use the tents. Soroti is already using the tents because they admit over 60 patients per day. And Soroti is just a few kilometers from Lrrh city with a very good road network. You're also very close to a YAM that has good number of patients, and that is your catchment area. So my advice to you is get the tents ready. Don't wait. get the tents ready and fill up your oxygen cylinders ready. We are losing people who are not vaccinated. And I really want to stress this to the 10% of your staff that are not vaccinated and to the entire population of Lrrh. We are losing people who are not vaccinated. If you're fully vaccinated and you have passed over 14 days after your vaccination, you may get infection, but it will be mild. Short of that, you may definitely get severe infection and pass on. I know there are still many myths and misconceptions surrounding vaccination. But there are many people here who are vaccinated and we have not died. And we are not going to die. And we are already starting an intervention in the Ministry of Health, which later on we shall cascade to the entire country.